Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we are going to go over the drug Insulin Aspart, also known as Novolog. This drug is classified as a rapid-acting insulin and is given for hyperglycemia. Remember that Novolog leaves no time for hyperglycemia, or that Insulin Aspart starts working very fast. Now, it cannot be mixed with other insulins besides NPH insulin. And in pregnant women, this drug has not yet been proven safe. Now, what we need to know is that this drug will bind to our transmembrane receptors and start a cascade of actions that eventually result in the placement of GLUT4 transporters into our cell membrane. This allows glucose to enter the cells by facilitated diffusion. This also means that the glucose level in the plasma will decrease. Now, it is very important that we know that insulin has another very important action. It will make the potassium leave the blood and enter our cells. Insulin activates a chain of reactions that eventually stimulate our sodium-potassium ATPases. Remember that these ATPases push sodium out of the cell and bring potassium into the cell. This is very important because food has a lot of glucose and potassium. If our bodies were to simply absorb all of this potassium and do nothing about it, it would cause us to have a paralytic arrhythmia. This is why it is a smart idea to intake glucose and potassium at the same time. You should be aware that your patient's insulin need will increase as their body experiences stressors. These stressors are things like surgery, sickness, trauma, or fever. Also, be aware of the possibility of developing a temporary hypokalemia when you administer insulin. What you need to know is that this drug has an onset of 10 minutes, a peak of 2 hours, and effects or duration of 5 hours. Remember that the Novolog address is 10 to 5. Onset in 10 minutes, peak in 2 hours or the lowest blood glucose, and it will last for 5 hours. The side effects of this drug may include hypoglycemia that can result in pallor and tachycardia, weight gain, and lipohypertrophy at the injection site. Some commonly tested material about this drug is that it is a rapid-acting insulin, and Novolog leaves no time for hyperglycemia. Remember that the address is 10 to 5, onset of 10 minutes, peak of 2 hours, and duration of 5 hours. And lastly, please remember that this drug will rapidly decrease your patient's blood glucose and blood potassium levels. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.